Hi guys, I'm Jessica Traver. I'm one of the pediatric sports medicine surgeons here at UT Houston.
And I'm Dr. Alfred Mansour. I'm also one of the pediatric orthopedic surgery sports medicine physicians here at UT Physicians.
Today we're going to be talking to you guys about injuries that we're seeing in growing athletes.
Yeah, and as we see the doors of the world open back up and kids thankfully getting back into sports, we're seeing an uptick of injuries. And I just want to pick Jessica's brain and ask her a few things about what she sees and how to keep kids out of trouble and give parents good information on how to move forward out of this pandemic.
So Alfred, what have you seen in regards to overuse injuries and just injuries that kids are having this summer?
So it's interesting, we actually can track the opening of sports with the injuries that start coming into our clinics, and I think some of the ones that I've seen early on really have been in the throwing athletes.
Sure.
And I think that kids who maybe haven't thrown for months and months, the rest has been good, but they've tried to get back too fast at a higher level, playing on their club teams, playing on select teams, and they can't match the lost training, and so instead they're just setting themselves up for these overuse injuries.
I think I see that in my clinic as well. I think that patients think that because they haven't been throwing as much, they almost want to double down and, get pitching coaches and log some more hours, just trying to work on their craft. And I think instead of helping, that ends up kind of overusing and overstressing their shoulders and elbows. So I see that as well.
And how do you, it really is an epidemic.
Right.
In Houston, year-round sports are available. What is some advice to tell very engaged parents and very diligent players about preventing these overuse throwing injuries?
Yeah, so I think that there are a couple things to consider. Number one, USA Baseball has some good criteria as far as rules for pitch counts and things like that. And so I think that it's important to remember that those rules are in place because they're supposed to be a cumulative sort of athletic exposure total guide for patients and their coaches. And that just because you're on a select team and play on a school team as well, that the exposure is still the same. And so I think it's important to not try to, cheat the system and get, try to get a level up on the competitor that's next to you by kind of doing extra time. I think that you have to be careful about your cumulative amount of training. And then I think that when it comes to being concerned or a red flag symptom with a thrower, that one of the most common complaints that I hear is that pitchers and throwers end up complaining of a loss of velocity and accuracy when they're playing. And so I think that is something that usually the player themselves notice pretty quickly, as well as the parents and the coaches. And so I think that's something that's very concerning.
And how would you differentiate kind of muscle soreness, getting back into activity pain, and pain that should bring up a red flag? Because lots of parents are going to have kids that complain of some soreness, but really, what would clue the parents or the coaches into saying this could be a little bit worse than what we would like to see?
Yeah, so I think that when athletes start to change and decrease their performance based on how much pain they have, I think that that's concerning.
Okay.
Most athletes who are at the elite level are pretty competitive, and so I think that if the athlete themselves is asking to come out or anything like that, then I think that that's concerning. And a very basic metric that I have is that if the athlete is having pain with just doing normal activities of daily living, like taking a shower, doing chores, just things like that, I think that's more concerning than just your typical run-of-the-mill soreness from training.
And would you say pretty consistently that there's not really a great source of safe elbow joint pain?
I think that's true. I think that in general, anything that's sore, a strain or sprain or anything like that usually is pretty short-lived. And I think that if you have any sustained pain that's longer, than just a single exposure, a single bump and bruise, that you would expect to get better after a couple days. And I think that that's something that's concerning and that you should have looked at by a medical professional.
So Jess, I think we got some great insight on the throwing athlete. What other sports are you seeing these overuse injuries in?
Right now, because it's summer, I think that we're seeing a lot of our AAU basketball players and year-round basketball athletes coming in with a lot of knee pain. Osgood Schlatter's is inflammation of the growth plate, right where the patellar tendon inserts onto the tibia. And I think that because those kids really, a lot of them weren't able to play basketball last summer, and even a lot of schools had their winter sports and seasons kind of cut short, and had a lot of different variety for that reason because of the pandemic. And so I think that now that they're sort of back training full time, we're seeing a lot of irritation there in the front of the knee with our basketball players.
And is there anything to be more concerned about? Because a lot of players have that kind of front of the knee pain. When should a red flag go up when you're looking at your son or daughter that's playing and complains of some knee pain?
Yeah, so I think that, as you mentioned, it's pretty common in most kids who did jumping sports, specifically basketball. But I think that pain that's sort of there in the front of the knee that doesn't limit athletic participation, or limit performance, I think is okay. Kids that I get more concerned with are the kids that have pain when they're just walking, when they feel like they just have a hard time standing up and sitting down in a chair, that they really feel that their activities of daily living are thrown off and a little bit more affected. Those are the kids I'm a little bit more concerned with.
Yeah, and I like to talk to families about preventing any limping, because I feel like that's something that everybody can see. So if the pain is enough that the child has to limp around to offload that area, that's a big red flag. And sometimes just offloading it a little bit, stretching can remedy it enough. What other things do you think underlying are important when you're kind of counseling these athletes?
Yeah, so I think especially in the child that's still growing, obviously we need to be aware of their growth plates, because the growth plate is constantly growing and changing. And so something that's super important, these kids are skeletally immature and still developing, is underlying vitamin D deficiency. Have you noticed that in your practice too?
Yeah, so very interesting. We are studying vitamin D in our fracture patients, our broken bone patients, and we're finding about 85% of the ones that need surgery are vitamin D deficient. And so
Wow.
that's in Houston, in the South, outdoors, and it's really opened our eyes to really look at vitamin D as an entity and an underlying risk factor, if you will, for bone injuries, bone pain, and fractures. So it's something I'm always very cognizant of, and counsel families on a lot, because it's easy to replete. There's a very safe window of levels that you can get patients to, so it doesn't take a lot of monitoring, and it's something that's easy to forget but really can impact players.
Yeah, I think that's something that's really important to pay attention to, because, taking care of our young athletes, it's sort of taking care of the whole package. And so it's not just their training, it's from a metabolic and a dietary and a nutrition standpoint as well. And I think that vitamin D, as you mentioned, is so easy to remedy and adjust. And, now they have vitamin D over-the-counter gummies. So even if your kid can't swallow a pill, they can still take a vitamin D gummy or a fruit snack.
So we've talked about the throwing athletes and basketball players.
Mm-hmm.
Let's pivot a little bit, and I want to pick your brain on some of the other sports that you're starting to see as the sports open back up and seeing these overuse injuries.
Sure. So I think that in the summer, we see a lot of cheer athletes, gymnasts, tumblers. A lot of those girls are starting to log a lot of hours again, and all of us know that the Tokyo Olympics are coming up, and so it's really wonderful to see all these high-level activities and skills that those girls have. Something that I notice is that in those sports, they use their upper extremities as weight-bearing extremities, which is a little bit different than some of the other sports we've talked about. And so things that we notice are a lot of overuse injuries with their elbows in a little bit of a different way, in a different capacity than the throwers.
Right. And what about other very specific injuries to those sports? And they're doing a lot of acrobatic maneuvers.
Sure.
Can you go into that a little bit more?
Yeah, so I think it's not uncommon for those athletes to really experience a lot of back pain. And I think that back pain for a normal growing adolescent athlete can be considered normal. We know that obviously the skeletal spine is constantly growing and changing, so a little bit of imbalance as things are kind of getting adjusted to their new position, and a little hamstring tightness is normal. But things that I think are more concerning are when the female athletes tend to have a little bit more pain when they do a lot of hyperextension activities. I think those pain with that specific maneuver is a little bit more concerning for me, and I start thinking about things like a stress fracture or stress reaction or something like that.
Right, and that can loop back into vitamin D.
Right.
That can loop back into overtraining. What about the pandemic that's really kind of set some of these kids up for back pain? would you say the virtual learning platform? Maybe
Yeah, so I think that every family and every athlete's home situation is unique, and I think that I've seen some kids who have been back to in-person learning for a while, and I think there's others that we're still doing virtual learning here at the end of the year. And so I think a lot of patients have been using their laptops full time for 8 hours plus a day, and that's something that they really hadn't done before. And so I think from a mechanical standpoint, they've literally asked their body and their skeletal spine to be in a different position than they've ever had to do previously.
Yeah, and I know my kids definitely don't think about posture when they're on the computer, so I think it's something that is kind of subtle, and as the hours really accumulate. 8 hours in front of a computer monitor instead of courses breaking up and going to different activities and things can really, for someone who's not used to that, can be an added load on the back.
Right. So regarding back pain, what are some red flag symptoms that you get increasingly concerned with?
So for me, obviously, back pain, that's where the kids are asking for pain medicine. I think that's concerning. So if it's not an achy back, I'm fine, maybe a Tylenol here and there. If they're really kind of debilitating back pain, if you will, or they're losing interest in their activities, kids that are highly motivated to spend hours and hours and hours doing a sport, looking to do other things, thinking of excuses why they can't do it, and say that their back is bothering them. Certainly pain that leaves the back and goes down the legs, that's probably a big red flag. Pretty rare in kids, obviously, but we do see that time to time. Slip disc, like adults have a little more commonly, but we can see that in kids. I think just any finding that raises some concern from a parent's perspective is certainly worth getting checked out.
Sure.
So what if we, again, kind of move into the female athlete space? So we talked about gymnasts, tumblers, lots of female athletes there. Are there added considerations as you really kind of hone into treating the female athlete that really help you stay out of trouble?
Yeah, so I think as a former female athlete, I think that there's a lot of different pressures that you feel when you're an adolescent athlete about things to do to kind of keep up with everybody else. And so the first being, that you always want to eat right and have good nutrition. I think there are certain sports in which an element of weight loss, just to potentially give you an edge from a competition standpoint, is something that a lot of people are very serious about. And I think that making sure that we have a healthy, well-balanced diet is important, but also not at the expense of overall well-maintained nutritional status. Something else that we can see that's a little bit more concerning, again, specifically with our female athletes, is any sort of abnormal disruption in the monthly cycle is concerning. I think that a lot of times can be common, especially in certain sports like runners and things like that. Maybe not atypical, but I think if it was if there's any sort of changes, I think that's concerning.
So you've mentioned kind of the female athlete with the unique concerns. More than just disruption of their normal rhythms and changes in their diet, are there any concerns from a bone standpoint that are fairly unique to the female athlete?
Yeah, sure. So I think that if we have a female athlete has abnormal, nutritional and metabolic processes, then that actually can affect the density of their bone and can predispose them to having things like stress fractures that can kind of present themselves after they end up doing kind of an overtraining type of a situation, but it can actually lead them to have more injuries than they would have if they would have just simply worked on their nutritional status. So speaking of other activities, what sport are you most excited about to come back this fall?
We can't talk about Texas without talking about football, and we are back in full swing. So what that brings is the fun, the sweat, the odor, but it also brings the injuries. So I have a rising 9th grader who's getting into football, and so you see a lot of pretty big kids and little kids, all various sizes, that are all running around, smashing into each other and trying to get back into shape, but they all have seasons kind of ramping up quickly, and so we're starting to see some of these injuries in the football player. And I would say there are a couple that are easy. I mean, everybody sees twisted ankles and broken wrists and things like that. What about the subtle ones? What are you seeing there, and how can parents who are dropping their kids off and picking them up and then communicate how was practice, what's going on, how can they really read between the lines and see some of these early problems brewing?
Yeah, so I think that, that having patients kind of increase working on their like strength training and things like that is a good way to kind of prevent some of these things that are a little bit more scary. But I think that having, you know, some underlying knee and hip pain kind of similar to some of the other sports that we've already talked about is pretty normal. I think obviously when a kid limps off the field and isn't able to complete a play or complete practice is concerning. But I think that there are a couple other things that I want to make sure that we're not missing. And so what would be something that, you know, could be masquerading as just simple run of the knee, hip or knee pain, and it's not?
Yeah, so something that we see a lot as orthopedic surgeons and probably sees more people before it gets to us is a hip problem called slipped capital femoral epiphysis. And it can be a lifelong problem if it's not picked up, and if it's picked up appropriately, then usually there's some pretty straightforward things that we can do about it. But the problem is, what makes it difficult is most of these kids present with knee pain. And so they'll say their knee hurts, they'll point to their knee region, and they'll limp. And if you don't take that deeper dive into the potential of it being a hip problem, you'll overlook it for months and months and months until it becomes a catastrophic problem. So we certainly both see a lot of that. And I think education to trainers, education to coaches, education to parents is probably the best prevention, because it really is one of those sneaks up on you. So what would you say are kind of the main things to be concerned about? Kid comes off the field, not necessarily an acute injury. Again, we're probably not going to overlook those, but just doesn't feel like something's right. Well, how do you take us through that as the parent?
Yeah, so I think that in general, a kid who's able to walk off the field usually is somebody that I'm not particularly worried about. I think that, you know, a kid having pain that prevents them from being able to fully move either their knee or hip is a little bit more concerning also. I think it's a little bit harder to kind of assess sort of that subacute injury in a hip where, you know, with a big bad knee injury, all of a sudden a child or an athlete's able to tell you that they've reliably like felt a pop and you see a lot of swelling and things like that. The hip just masquerades a little bit more subtly than that.
Yeah, so I would echo all that and say that limping for me is kind of the biggest thing. So kind of back to a lot of these lower extremity injuries, if a child is unable to put their full weight through their leg because something hurts, that should clue you into saying this may be something a little bit worse than what we can see. And then if they're not walking like they used to, and I think that it can sneak up on you because you see them every day and very subtle changes, but very commonly parents will tell me, yeah, they've kind of started to walk differently, they have a little bit more of a waddle, or their foot turns out a little bit more. That really the parent doesn't know the diagnosis, but those are very brilliant observations that get you to that. So I think as a parent or as a coach, if one leg doesn't match the other leg, then that's a red flag. If limping on one side and not on the other, that's a red flag. And if performance starts to decline, another red flag that something else could be going on.
Yeah, I think that a non-ambulatory child essentially always needs evaluation by a medical professional. I think that's a pretty good rule of thumb.
Yeah, and a lot of kids will know, like, it feels sore. It feels like a muscle that's sore, and that tends to be a little safer than if they tell you it feels like a muscle that's sore, you should still be able to walk. And so they may be interpreting their muscle as aching, but if their body is saying, I cannot put weight on it, then that should kind of raise the search for something else that's going on.
Sure.
Okay, Jess, so we've all watched games, we've all seen kids, and we see lots of athletes. So one thing that parents are pretty good at is identifying early talent. Okay, so they see kids that are maybe just kind of early bloomers, they kind of got their skill set, they're very coordinated. Does early talent equal early subspecialization in sports? Like, why? Because I feel like we do that, and can we go wrong?
Yeah, so I think that's a great question. I think in my clinic, and I'm sure as yours, that a lot of times that when a parent sees a child who's excelling early, that's number one, thrilling and wonderful. But I think it's important to kind of caution both parents and athletes that kind of specializing in sports early can actually have a negative impact on the health of the overall athlete, can actually predispose them to injury. And so that I think that there are a couple of rules of thumb that I like to suggest or kind of give advice too, to kind of keep the athletes safe while still allowing them to continue to develop their talents. So the first in general is that athletes should really not participate in the same sport for more than 8 months out of a year.
Okay.
I think it's important to have kids participate in multiple sports for, number one, activating different muscle groups, and as we kind of mentioned earlier, the overuse injuries are something that we need to be aware of in these young athletes that are still growing. And so by playing different sports, which kind of favors different muscle groups and things like that, it can be a little protective. That kids really shouldn't play the same sport in multiple leagues at the same time. I think it's important to remember that, as we mentioned, when it comes to things like baseball and stuff like that, the same number of athletic exposures can still be harming to a patient, whether you're in a school league or not. And lastly, I do think it's important to remember that our kids really shouldn't be participating in more hours of sports per week than their actual age. That's sort of an easy rule of thumb to follow, and something to be mindful about.
So this early sports specialization topic is so hot. We've got Olympics coming up. We've got athletes of all ages, from all different walks of life, all over the world, that are at peak performance. And our kids see this, our kids strive to this, and to them it's more and more and more. Who really do you think should take charge of regulating that?
Yeah, I think that's a good question. I think in general, it's hard to ask the child to be the one to regulate their athletic activity. I think for the most part, it's always fun and they want to, be on different teams and have all those good experiences. But I really think the onus is to the parents and the coaches, really, is that I think that ultimately we know that participating in multiple sports can not only help patients stay healthy, but it can actually supplement their athletic ability. An interesting fact, I think, is that in the last year that 91% of the first round NFL draft picks actually played multiple sports in high school, not just football.
Yeah, so that speaks to balancing that, getting ahead of the competition by doing more and more of the same sport, with really kind of cross training and
Right.
learning multiple skills, and realizing that, hey, maybe in this sport, what I didn't realize was that it was going to help me perform in a sport that's actually taken me further. So some of it can be a little counterintuitive, and I think parents certainly have the best intentions for this, but it is something that really wraps around and can lead to kids that are disheartened, kids that end up peaking early and then burning out. And so kind of the best years of their athletic career, you see them start to decrease their performance, and that's a really tough thing mentally.
Yeah, I agree, and I think it's important, at least from our standpoint, is to really educate parents when ever athletes and their families come into clinic, because I don't think every coach or every trainer is the same or has that same knowledge base to really encourage that. And so I think it's important to encourage parents to be advocates for their children, and knowing things about which ages are appropriate to introduce which types of pitches and things like that.
Right. I think that one of the unique aspects about kids is their tolerance to repetitive injury. And so if our adult brains imply kind of what we think the kids can do, when we get tired, we stop. Whereas kids just kind of go, and then have an overuse injury. So we have very different patterns of repetitive load tolerance. And so as an adult, good intentions, but you can't say that the kids are going to be able to regulate themselves in the same way, because they don't.
Right, of course. So now that we've talked about a lot of different sports and athletes and risk factors, what are just some closing thoughts that you have about us taking care of kids that are still growing?
So I think it's a very holistic approach. I mean, we're all on the same team. We love these kids that we take care of. We're partnering with their parents, we're partnering with their coaches, the athletic training staff, really to allow kids to have fun, to release energy, and really to challenge themselves to be better at something than they thought that they could be as good at. And I think that we just need to reinforce that injuries are a part of sports, and that we're trying to help you through them, that we're not really trying to prevent you from doing something you love. But at the same time, if you have repetitive injuries and overuse injuries, then it's going to drag you out of those things and have you miss the goals that you're setting for yourself when it really matters. And I tell kids, it's not the flash in the pan, right? You want to really cultivate that fire and get them going on something that will prepare them kind of for lifelong sports. And the overuse injuries really just take the joy out of it, because if they do it and it hurts, that's counter to what they're trying to do.
Right, it's just not fun anymore. I think those are all great points. I think that the thing to sort of emphasize and remind to the athletes themselves is that, overuse injuries can kind of lag on for a long time. And I think that giving them the respect that they deserve and kind of appropriately treating things actually ends up shortening the recovery time and allows kids to get back to the field and their sports quicker and more safely.
Yeah, and I would close with saying we're here to partner with parents, and sometimes as a parent, I'm a parent of young athletes, it's hard to coach your kids through some of these medical overuse issues, and that's really our role. And we like doing that. We don't like to see kids getting hurt, but we really can understand it on a population scale, and so we can really reinforce some of the thoughts that parents may be having, that coaches may be having, really to help these kids have fun. The fun that they're trying to work so hard to have.
Right. I think the concept of no pain, no gain doesn't really apply to this particular patient population.
Right. I'd like to thank Jessica for being here and sharing with me our thoughts and our passions for taking care of these youth athletes, and just thank you guys for the time that you've given us to speak to you today.
If you know a patient or a child of yours that has experienced any of the symptoms of any of the things that we've talked about today, then by all means reach out to a certified medical professional or us. We would be more than happy to take care of you and your family. By all means, follow us on social media and enjoy sports and be safe out there.